What are those muscles? External oblique, internal oblique, transversus abdominis. And we say that the nerve supply is for lower Good. So, in today's lecture, we little bit elaborate that lecture, the previous lecture. And here we have two structures, the lower limb as well as human muscular body. This is the human muscular system. Human muscular system. Because it is a system, it's not only composed of muscles, but also consists of viscera as well. It is a complicated structure. It is not an easy structure. So we have started in the previous lecture from the head. We said you can see here the structure. We said that this is the flat bone. This is the flat. Yes, this is the flat. You can see, here you see a soft membrane-like structure that is called skull. That is called skull. It is a soft structure. Then, which is in turn followed by the skull, which is followed by the skull. The skull is hard. It is hard due to calcium deposition. Remember the system of the bone composition, if you remember that. If you remember the composition of bone, we talked about those structures, that how bones are formed and what are the, you can say, the elements from which bone is formed. We talked about the trabecular system, we talked about the eversion system, eversion canal. You remember that. We talked about the collagen, we talked about the elements. We said that calcium. The main content of the bone is calcium, due to which it gives hardness to the bone. So this is a flat type of bone, and you can see here the suture. Can you see here the suture? Then this is fixed. This is fixed. In this model, this is fixed, so we can't remove it. Then we talked about the muscles of the eye. We say that it is a round muscle around the eye, that is called as the orbicularis oculi muscle. This is orbicularis oculi muscle, and it is suspended. It is not attached behind. It is free. So that's why if blow occurs on the top of the head or here in front of the head, so the area which is very prone to the injury, that is this muscle, orbicularis oculi muscle, and it got increased blood supply and swelled up. Then we come towards the face, and face we say that there are muscles, masseter muscles, muscle of mastication, which helps in chewing of food. We say that. Then we come and discussed about the structure which is present around the mouth, and that is called as the orbicularis oris. This is oris because this is oral cavity, not eye. There is oculi related to the eye. This is oris related to the oral cavity. So this is the muscle. This is also a round muscle, round type of muscle around the mouth. Then we come towards the neck region, and we say there are certain muscles. The sternocleidomastoid muscle starting from here, the mastoid bone process, and it continues down. You can see here this muscle, It is you can say a band-like structure. This is called the sternocleidomastoid because one end of it is attached to the sternum and one end it is attached to the mastoid process. That's why it is called as the sternocleidomastoid muscle of the neck. Sternocleidomastoid muscle. You are getting me?
Yes, sir.
Excellent. Then we say that there are certain muscles in shoulder region, and you can see the muscles which is very prominent here, and these muscles are called trapezius. Trapezius have different fibers,
Yes.
upper, medial, and lower. Upper trap, medial, and lower trap. So the area which is very prone to the trigger points where patient feels discomfort. Patients say that I have, if you palpate that area, if you press that area, the patient told you that I feel pain here. It means that there are certain things which are present and it irritates the patient. And there are, you can say, the things, the structures which are present, that is the trigger points. Later we will discuss the myotomes and dermatomes as well. So, what the therapists do, what's our role, what's your role in that scenario? You can use different type of tests, yes, to evaluate what's the problem.
Electrotherapy.
As we have done already the shoulder, different special tests for the shoulder and also for the impingement. We say that if there is labral tear, then there is a test which is used for that. The bicep load 1, bicep load 2 test, apprehension test, speed test, Yergensen test, Yoakum test. These are different sorts of tests and you can apply on different position to evaluate shoulder problems. Later we will discuss and have a special lecture arranged on the special test of the shoulder. And I will discuss that in biomechanics class, inshallah. In biomechanics, I will elaborate on the human body and these special type of tests which we used in order to evaluate shoulder pathologies, injuries. The patient will say that I am feeling pain as well as I am feeling pain in my shoulder as well as in my arm. And if you ask in history, you say that is there any numbness you can feel. Some patient will told you that yes, I feel numbness sensation up to my elbow. Some patients will told you that yes, I feel numbness, that is the walking ants like sensation, walking ants like sensation in my arm, and whole arm continue up to the hand. The fingers will also numb. So it means that there is a certain problem. Maybe the problem is present in the neck region. Maybe there are pathology which arises from the neck. Maybe there is impingement of the nerve in the facet joints of the neck. Maybe there is impingement of the nerve in the shoulder joint. Maybe there is impingement in the elbow joint. So you can then separate these different areas in order to evaluate the specific cause of nerve impingement, the specific cause of shoulder injury. Remember, this is a general lecture. This is not specifically, we are not talking about a specific structure. This is a general structure in order to give you an idea that what's going on. If a patient comes to you and presents with different pathologies. So last time we discussed that the muscle you can see here, that is called as the deltoid muscle, and it has its fibers, anterior fiber, medial and lateral fiber. This is the anterior fiber, and some patients come to you with the pathology and he says, he or she said that I cannot raise my hand or cannot elevate my hand. So the doctors first click the idea that the shoulder might be frozen. The shoulder might be frozen because you cannot achieve that range. Are you getting? It may be you can say in range, not too much going in the mid or out range. So it will be limited, the range will be limited. And having pain. So if you see the capsule, the anterior capsule most prone to be tightness in the frozen shoulder. So what the therapists do, if you talk about the trapezius muscle, if there is trigger points, then you will press that area, the trigger point, for 1 minute. Press each trigger point for 1 minute, then release. Press each trigger point for 1 minute, then release. Then it will give you release. Then we can use PNF techniques, different types of stretches, in order to stretch the short muscles. If there is, remember, it depends on your activity of daily living ADLs. If patient sitting posture, standing posture, office work, that is not good. In order to use his or her muscles, specifically, so these pathologies occur. The muscles will be short, the muscles will be shorter in length and having pain. So we can give stretch like this, the opposite, on the opposite side, one hand here and one hand here. To stretch it, if I am giving stretch on the left side, so I will stretch it on the left side and stabilize the shoulder here. So I will provide a stretch. Then on the same side, if trigger points are present here, so I will give the stretch on that side. So it will give you an relaxation sort of sensation. Then you can also do PNF technique like traction. You can also provide traction. Grip the area, grip the lower jaw, grip the chin bone here, and try and like this. Make a soft grip, not too hard, because it irritates the patient. Now give an intermittent traction by continuously watching the patient discomfort. Continuously watching the patient discomfort. So not too much, you can say, traction applied at the same time. Slowly and gradually you can apply traction to the patient. So it will increase the vertebral space. It will give you a vertebral space and ease of pain. So you can also apply short wave diathermy. You can also give short wave diathermy to the patient. There are some you can say equipments available that is like electric and heating pads. You can also put a electric heating pad for 15 to 20 minutes. The pain will be released, and it has a very great soothing effect. The patient will feel relaxed. So it is a modality you can use. Then you can also do soft tissue work on the muscles. Soft tissue work. Try to use your thumb and make it soften for 2 to 3 minutes, or for maximum for 4 minutes, not exceeding them, more, and slowly and gently. Not too much hard, you can say push. Too much hard, press to the patient. It should be slow, it should be light. Then you can release the muscle like this. You can also provide in acute injury, if there is an acute injury, you can also give him ultrasonic therapy, therapeutic ultrasound. Remember, there are two things. One is diagnostic ultrasound, and the other one is therapeutic ultrasound. There is difference between the two. The diagnostic ultrasound, there is an you can say screen, and you have a probe. You have the ultrasonic gel. You put the gel on the ultrasonic probe and make circular movement of the probe on that painful area. Try to release the pain of that patient. So slowly and gradually apply in circles, then in short circles. Then it will release the pain for 5 minutes or for 10 minutes. You can arrange the intensity up to your way, because it depends on the skill of the doctor and how he can better know the condition. But remember, ultrasonic therapeutic ultrasound, it is good in initial days. 3 to 4 days it works well. After that, if the problem is 15 days, 20 days, it's not so, you can say, effective. It is not so effective. Then we talk the frozen shoulder. If the patient comes with a frozen shoulder, what you can do? You can give PNF technique. You can provide traction. You can provide intermittent traction in first 1 week. Not too much traction, because the patient will told you that I am feeling pain when you track my arm. So try to eliminate, try to decrease your force of input which you are putting to the patient. Then you can also do soft tissue work on the muscles, on the anterior fibers, on the anterior shoulder capsule, and also on the bicep muscles, and also on the tricep. You can palpate and you can easily find triggers, and muscle spasms are there. The muscle should be tight there. It's you feel like the skin is tight to the skin is tight to the muscle. You feel that section, that it looks like a sheet. It makes a close pack sheet. So you can feel if it is released, then the skin will be separate from the muscles. It is not attached too much, and you can easily palpate the trigger points in that area, specifically in frozen shoulder. In a series, it makes in a series. You would release that. You can also give him the shoulder wheel exercise. Ask the patient that you can do it up to your end range, to which he is comfortable to do. After that, gradually increase the intensity, and he will do a full circle. He will make a full circle then. Then if he make a full circle, slowly and gradually his range will increase. You can also give him pendular exercises. You told the patient that do pendular exercises, one hand on your chair or one hand on the support and the other hand is hand which is injured. So you can do like this, 20 to 30 repetitions 3 times a day in clockwise direction and similar in anti-clockwise direction. So it will release your joint stiffness. It will release joint stiffness and provide mobility to the joint. Then you can also give him, this is the pendular exercise. You can also provide interior stretch exercises. That is specifically designed for the frozen shoulder patient. You can sit the patient and in front of table, one hand in the front of table, and try to make flexion of your trunk. He will flex his trunk according to the anterior movement of his arm. If the stretch is filled in the shoulder, so ask the patient hold there for 10 seconds. Then again come towards your normal or to your previous position or to your neutral position. Then again do the same thing and try to do it 10 times a day for 10 seconds. At least 3 times a day. If the patient can't be able to do it for 3 times a day, so he might do it 2 times a day. According to the patient condition, you will make the exercise like this. We removed that structure in the previous class, and we said that there are muscles, the bicep and the tricep. Give me a pen. So if we remove this structure, you can see here the muscles. You can see the structure, the tricep muscles, which are present on the lower side. Remember, this is your anatomical position. So this is your bicep muscle, and behind this is the tricep muscle. The bicep muscle is the 2 heads, short head and long head. So this is the main bulk of your muscle, and it should be strengthened enough. If it is strengthened and your tricep is strengthened, then you can do each task easily. You can see the structure here, the muscles here, the continuation of the muscles here. You can see there's its tendons, small tendons arises from here, and it forms the flexor and reticulum sheet, the carpal tunnel. The carpal tunnel, it works as a tunnel, and there are certain vessels passes through this tunnel. And if what structure is the median nerve, for example, say the median nerve, it is compressed here, so you will feel the sensation here. You can see here the tendons coming out, continues, and on the dorsal aspect of the hand. And on the thumb, it is separate from the rest of the small, soft connective tissues. You can see here it forms a sheet-like structure, combined together and form a sheet-like structure on the palmar aspect of the hand. And you can see it is separate on the thumb area. This is the deltoid portion, half, because we removed that, so this is the deltoid muscle. Clear up to here? Any question? Now if we come towards the chest area, you can see here there are two basic muscles important, that is the pectoralis major muscle and the pectoralis minor. The pectoralis major muscle forms the bulk on the chest area, and you can see that the bodybuilders specifically do the chest exercises in order to make the chest to be prominent. So these are the basic muscles, and which is led by internally by 3 flips of the pectoralis minor muscles, and 3/4-5th rib is the attachment side. You can see here the sternal bone. This is the sternal bone. There are the structures which are present that are called clavicle. Clavicle is also called the beauty bone. So it forms sternoclavicular joint. The joint which forms between the sternum and clavicle, that is called sternoclavicular joint. And this is the sternum, this is the manubrium. So the manubrium is joined with the sternum by the manubrosternal joint. Here you can see that it is continued, and at the ends there is a small structure which is called the xiphoid process, and the joint which is formed between the sternum, body of the sternum, and the xiphoid process is called the xipisternal joint. Then you can see the rib. We say that the first rib is small. The first rib is very small. Then it is continued by the rest of the ribs, and when it comes up to the 11th and 12th ribs, so they are floating ribs. You can see here in the skeleton easily. Look at this, the costal cartilage. You can easily see here in the chest rib. You can see here the first rib, which is led by the second, which is led, then continues followed by the third rib, then the fourth. If you auscultate the patient, you can auscultate him in that area, third, fourth, and like that. And on the posterior aspect, you can also auscultate the patient in order to see the chest complications. So this is the joint which is formed between the ribs and with the sternum, that is called with the costal cartilage is the.
Which one, sir?
These are the costal cartilage.
Yes, sir.
And it is attached with the ribs. These are soft structures, these are hard structures. Intercostal cartilage. They are attached with the sternum. And there are certain muscles. Remember, this is formed a diaphragm. This is a diaphragm because it is also lined by the muscles internally here. All muscles are here. Here are muscles. And the diaphragm acts in the forceful inspiration and expiration activities. And these are covered by the intercostal muscles. These spaces are covered by the intercostal muscles. Then you can see the structures here. These are the spinous processes. Continue up to the tail region. There are the 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae, and 5 sacral vertebrae which are fused in one bone, and which is led by, at the end, is the coccyx, the tailbone. This is the scapula. This is the scapula, this is spine of the scapula. This is the acromial process for the attachment with the clavicle. And because the acromial process is on the clavicle are on the, and it has a side where the clavicle comes and attached to that side. So the acromioclavicular joint. So the joint form that is called acromioclavicular joint. You can see here there is a depression on this side, and we have already have a class before about this structure. This is called as the glenoid cavity. The glenoid cavity is, remember, this is a shallow cavity, and it is It is
capsule cover.
bounded by the
Femur.
labrum.
Labor.
If you remember, I told you labral tears.
Yes,
So
sir.
this is a fibrocartilage ring, and it is present over here. If it is, remember, this is a shallow depression, and it can be teared easily. It can be torn out easily, and the head of the humerus can be slipped easily over the fibrocartilage ring,
Yes, sir.
and will be subluxate as well as if it is ruptured completely due to any injury in RTA, the roadside accident, it can be completely out of from the glenoid cavity, and that is called as dislocation. One is subluxation, the other thing is called dislocation. Complete moving of the head from the glenoid cavity is called dislocation. If it is present here and it comes a little bit displaced from its position, then it is called as the subluxation, not dislocation. So these are points to be remembered. This is the differentiation point. You can see here that on the front there is present a depression on this side of the shoulder blade, that is called as the subscapular region, and this is the concavity here present, and the muscle which is present there is called as the subscapularis. Here the muscles on this depression near the spine of the
Supraspinatus.
scapula, that is called as the supraspinatus muscle. And supraspinatus muscle, that is, remember that muscle, there are four muscles, these muscles are called rotator cuff muscles: supraspinatus, infraspinatus, teres minor, subscapularis. These are the muscles. These four muscles are called rotator cuff muscles. Here you can see this is a skull. This is a skull bone. It is a flat bone, flat type of bone. If you open up this structure, it is clear here in this bone, the flat bone. You can see here the sutures easily. These are the sutures, the skull sutures. And we say that in pneumatic bone, in pneumate, you can see here the depression. If you press the area, you will feel depression in early ages, in early baby ages. And here are different fossa. There are fossas in which brain is present. The frontal lobe, the occipital lobe, the temporal lobe, the parietal lobes. Okay, got here. So I think it's enough for today's lecture. This generally allowed me, but little bit we want to continue it from here. We don't find time to explain the lower limb structure because it is very important. If we little bit elaborate, you can see here the muscles that are separated on the anterior compartment. That is the quad muscle. That is the rectus femoris.
Quad muscles.
Quad muscles. Lateral, medial, and anterior fibers. So these are the fibers that are present here, and it forms the quad muscles. There are four muscles of the quad, and these are muscles of the knee joint. It provides mobility to the knee. And on the posterior side, these are the posterior side, the muscles which are present are the hamstring muscles, and the hamstring muscles also provides movement on the knee joint. If one is flexed, the other will extend the knee joint. And this is, you can see here the structure. This is called as the gastroc region, in which calf muscles are present. It forms the main bulk of the lower limb. If we remove one of the limb, if we remove one of the muscle, you can see here the gastroc muscles, which is on its sides there are present certain muscles that are called soleus muscles. There is main bulk of the gastroc muscle.
Superficial
Got it.
muscles, these are.
And you can see here the greater saphenous vein. It can easily be passed over there, and it provides what? It provides help the saphenous vein for the movement of blood, the return of the blood. So it is important. We will later talk about the greater saphenous vein and what is its function. So you can see here it has, if you open up this muscle, you can see here that here is a structure present inside these two fibers muscles.